Hi, my name is LeAnn Burgau. I'm the owner of Burgau Insurance Agency here in Perham. We're a local independent agency specializing in the Medicare health and prescription plan options and also in the individual and family plans through MNsure. Over the many years that I have been involved in the Medicare health plan market, I have found that one of the biggest obstacles Medicare clients face is the confusion surrounding Medicare and the inability to have their questions answered and have those questions answered correctly. At Burgau Insurance, our goal is to educate our clients so that they understand how Medicare works, the costs associated with Medicare, the different types of plans available to them, and the costs associated with their prescription drug coverage. So to help other people understand Medicare and to answer some of those questions we are most often asked, I'm doing a series of short videos to answer some of those questions. Today, I'd like to tackle what I feel is one of the most confusing aspects of Medicare, and that's Medicare Part D. Medicare Part D is the prescription drug coverage. These prescription plans are run by Medicare-approved private insurance companies and help pay for the cost of outpatient prescription drugs. One of the first questions we are asked is, do I have to enroll in Part D? I'm maybe not taking any prescriptions or maybe one or two inexpensive generics. The decision is yours, but if you don't enroll in Part D when you are first eligible, you do incur a penalty. And that penalty is added to the premium of a plan if you choose to enroll in Part D later on. Whether you have your drug coverage through an Advantage plan or a standalone drug plan, there are 4 levels of payment stages. Most plans now have deductibles, co-insurances or co-payments when you pick up your prescriptions, and all plans have a specific formulary or list of drugs that they do cover. In most plans, prescription drugs are arranged in tiers and are assigned a fixed dollar value based on that tier. For example, a Tier 1 might be generics, Tier 2 preferred generics, and Tier 3 might be a brand name. Drug formularies vary significantly from plan to plan, and they can change from year to year, so it's very important to do an annual review of your drug coverage. Just another service that we provide at Burgau Insurance. The first payment stage is the annual deductible stage. Medicare sets that deductible. This year in 2021, that deductible is $445. During the deductible, you pay 100% of the cost of your medications until that deductible has been met. Once met, you move into the second level, the initial coverage stage. During this stage, you will have a copay or coinsurance on your prescriptions, and the plan will pick up the remainder of the cost. When what you have paid plus what the insurance company has paid, when that totals $4,130, you then move into the third level, which is the coverage gap, or most people know it as the donut hole. During this stage, prior to 2011, the insured was responsible for 100% of the cost of their medications. In 2021, all drugs are now discounted 75%, so the client has a 25% coinsurance on their prescriptions while in the coverage gap. When what the client has paid plus what the insurance company has paid, when that totals $6,550, you move into the fourth level. That level is called catastrophic coverage. During that level, your generics are $3.70 for a 30-day supply, brand names $9.20 for a 30-day supply, or 5%, whichever is greater. You then remain in catastrophic coverage until December 31st, till the end of the year, and then on January 1st, you start back up at the deductible stage. It's important to remember that with the Medicare Part D, there is no out-of-pocket maximum. There is no limit on how much you could potentially spend on your prescriptions. If you do qualify for the extra help or low income subsidy from Medicare, the deductible and coverage gap may not apply to you, and you may have a lower cost on your medications. I hope this video has helped you understand Medicare Part D and the cost associated with Medicare Part D. Because these plans do change every year, and also your prescriptions can change from year to year, it's very important that you have an annual review done of your drug coverage. Let us at Burgau Insurance answer any of your Medicare questions. Whether you're a current client or you just have a question that you need answered, feel free to contact us. We are a local independent agency here to help you with your Medicare questions. We never charge for any of our services. Thank you for your time today, and watch for future videos answering those Medicare questions.
To watch previous videos, go to burgauinsurance.com.